Suctioning rationales. Assess the patient's lung sounds and oxygenation status via pulse oximeter. This assessment data indicates the need for suctioning and allows the nurse to monitor the effect of suction on the patient's level of oxygenation. Explain the procedure to the patient before beginning offering reassurance. The patient may be apprehensive about choking and about inability to communicate. Perform hand hygiene. Put on non-sterile gloves, goggles, gown, and mask. Hand hygiene prevents bacteria on hands. PPE protects the nurse. Turn on suction for closed system. If set too high, this causes trauma to the tissues. Open the suction catheter kit. Having equipment ready helps prevent delays or interruptions. Fill basin with sterile water. This provides sterile solution for clearing suction catheter secretions. Put sterile gloves on the dominant hand. Equipment that will contact the patient's lower airway must remain sterile to prevent infection. Ventilate the patient with manual resuscitation bag and high flow oxygen for about 30 seconds, or turn on the suction mode of the ventilator to hyperoxygenate the patient. This prevents hypoxia during suctioning. Pick up suction catheter in sterile gloved hand and connect to the suction. This prevents contamination. Insert the suction catheter at least as far as the end of the tubing without applying suction, just far enough to stimulate a cough-gag reflex. Inserting the catheter without applying suction permits insertion without causing trauma to the tissues. Apply suction while withdrawing and gently rotating the catheter 360 degrees for no longer than 10 to 15 seconds. Prolonged suctioning may result in hypoxia and dysrhythmias, leading to cardiac arrest. Reoxygenate the patient and inflate the lungs for several breaths with manual resuscitation bag, or allow the ventilator to reoxygenate the patient for several breaths. This prevents hypoxia during procedure and restores oxygen supply. Rinse catheter by suctioning a few milliliters of sterile water solution from the basin between suction attempts. Keep suction catheter patent. Repeat steps 8 to 13 until airway is clear. This ensures the removal of all tracheal secretions. Suction the oropharyngeal cavity after completing the tracheal suctioning. This avoids contamination of the trachea with oropharyngeal secretions and organisms.